And well, I'm not gonna lie, I tried my very best to look for some eye puns that aren't cornea, but no such luck. Drats. But on a more serious note, we are sitting down with Dr. Biondo. He's an optometrist from our sponsor, Kirkwood Eye Associates, and he's sharing how one very common eye condition can be prevented and treated after achieving a lifelong dream of opening up his own practice in St. Louis.
At Kirkwood Eye Associates, we're a full spectrum eye care facility. So we do general eye care, glasses, contacts. We do disease treatment for glaucoma, macular degeneration, dry eye, and specialize in the fitting of specialty lenses for keratoconus.
But the one thing that sets this eye doctor apart from the rest is his variety of treatment methods for a relatively common eye condition, dry eye.
That's a difficult question. Basically, dry eye is an imbalance or incomplete tear film on the surface of the eye. That tear film is there to protect the eye and improve the optics of the visual system. And in some people, that tear film can be incomplete or unstable.
And I know what you're thinking, how do I know if I have dry eye?
Symptoms can range all the way from just simple blurred vision to discomfort, including itching, burning, tearing. I think the biggest misconception is that dry eyes always feel dry. The number one symptom that we see with dry eye syndrome is blurred vision or variable vision. Typically or often, people actually have excessive watering or tearing of the eyes. This is because the tear film is not stable and the body tries to compensate by overproducing essentially the wrong type of tear.
These are the symptoms, but what's the culprit behind this condition?
There are a lot of causes for dry eye. It can be genetic, it can be hormonal, certain medications can lead to dry eye. What we're seeing these days is excessive screen use that's tied to dry eye and tear film imbalance. Environmental factors can also play a role.
While some of these sources of dry eye can't be avoided, Dr. Biondo says there are a few things that can keep this condition away.
Yeah, there's a lot that you can do. Avoid any fans that blow directly on you either during the day or while you sleep. Take breaks when you're using devices. Make sure you're blinking. I know it sounds kind of silly, but when we stare at screens or books or anything near for extended periods of time, we tend to mute our blink reflex. And that blink reflex is what actually squeezes or expresses tears. So remembering to do full and complete blinks, take breaks, look away from the screen, and doing this once or twice an hour can have a big impact on tear film quality.
Making sure your tears do their job. If you feel like they're not, it might be time for a quick checkup at the eye doctor.
And I think that's important, the examination portion, because there are so many types of dry eye. There's actually 3 layers to our tear film. Each one of those layers is produced by a different component within our eyelids or our ocular surface. So determining what type of dry eye you have is the first step in determining what treatment options are going to be best. And then treatment options can also vary based on severity. So the more severe the patient's symptoms are or the signs of dry eye are, that will dictate where our treatment options lead. Especially as far as dry eye is concerned, we have treatment options that many other places in town don't have. We can treat the underlying cause of dry eye in many cases, and even if the underlying cause is systemic and therefore caused outside of the eye, we can offer palliative relief that can allow patients to function more normally. Outside of that, just in general, at Kirkwood Eye Associates, we have a very family-oriented approach to eye care. We treat each patient as they were one of our own family members, and we try to offer first-rate eye care and a first-rate experience to every person who walks in the door.
For more information on Kirkwood Eye Associates, head online to kirkwoodeye.com. In Kirkwood, Chelsea Haynes, Studio STL.